Last year, there was a protracted battle between government and healthcare workers who protested their poor working conditions. After a number of engagements with President Museveni, a number of solutions were agreed, among them the increment of healthcare workers' remuneration, as well as their absorption into the workforce. As such, President Museveni directed the Ministry of Health to implement these resolutions. However, the Ministry of Health now says that it may not be in position to absorb medical interns into its workforce in the next financial year of 2023-2024. In her letter to the Federation of Uganda Medical Interns on 20th January this year, Permanent Secretary of the Ministry of Health, Dr. Diana Atwine, noted that any move to recruit new personnel is subject to the presence of a vacancy and the funds to support the filled vacancy.
There is always guidance from His Excellency the President, and this guidance can be made possible within the frameworks of government and also the financial implication. So every guidance has a financial implication.
This is in addition to a ban on recruitment of new personnel that was imposed by the Ministry of Public Service last year.
So it's until there is guidance from public service that those positions can be filled. But those ones where there is wage, then there is always replacement.
But the ministry is hopeful that once it concludes the ongoing restructuring of all public health facilities in the country, in addition to funds being availed, it will absorb these medical practitioners.
There will be openings available and we'll be able to absorb these doctors.
However, Uganda Medical Association is concerned with this news, stating that the recruitment of the interns will help to address the critical gap that exists within the country's healthcare workforce.
These doctors' work mainly would be to ensure that early diagnosis is made, emergency care is provided to mothers, most of those who are in the process of labor, and also to take care of children who are newly born, and reduce on maternal mortality rates, the child mortality rates in the country.
He has advised government to consider sourcing funds from other agencies.
Government has always been doing budget cuts in different sectors to cater priority areas. So I think this is an area where such a thing can be done. Government can cut the budgets on other activities or projects which are not very urgent.
Dr. Atwine's letter to the Federation of Uganda Medical Interns comes as its leaders prepare for another engagement with President Museveni. Joyce Nakato, NTV Tonight.